4. And then so that we can use a clean surface each time. So we start furthest away from our period area and we'll wipe with the first clean surface. Then we'll fold back to expose a new clean surface. We'll wipe with that clean surface. And then we'll fold back and expose a new clean surface. Then we'll wipe the labia majora and then expose a new clean surface. Then we'll wipe, and then this towel is done because we used all the clean surfaces. Then we'll get another towel, warm and soapy. We'll take our non-dominant hand and expose the labia minora. Do the same thing. We'll wipe, get rid of that contaminated area, and we'll wipe again. All right, so now that I've wiped all of our areas, in our perfect world, we can get rid of this towel. We will get us a new towel, and that towel will just be warm water. This will be to rinse away all of the soap. So with this towel, each time exposing a new surface, we will wipe, 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 expose, wipe, wipe. But each time it will be with a clean surface. Okay, so still same thing, peeling back. Then we will get another towel that's dry and do the same thing. We will wipe, wipe, but we'll make sure to be gentle. If you have to, just pat. Right. Okay? But you want to make sure you get your resident dry because you want to make sure that they don't have a yeast infection because you left the skin moist. Okay? So at the end of that, if your resident does not have a catheter, then you can roll them over and do the back. If they do have a catheter, then this will be the point where you did catheter care. If you had a male resident,
Okay, this is where I came in.
okay. Then you would do testicles.
Tip to scrotum. Tip to scrotum.
Oh, tip. This is it.
Yeah.
And then you would do tip to scrotum because you have to make sure that you're not introducing bacteria by pushing it into here. Okay? Then you would make sure that when you did the testicles and here, that you're still using your 3 towels. You're gonna do wet, soapy, then wet, and then dry. Okay? Then after that, and before turning, then we're going to take off our gloves. We're going to switch to some dry gloves, to some clean gloves. That glove didn't like me.
It would not be St. Catherine's video if we didn't have this in the back of our
Oh,
training.
it would
video.
not. It would not. It's perfect. We're going to get another towel, another 3 towels. So with the first one, this soapy. We're going to grab here, and we're going to work our way down, all the way to the bifurcation. Then you'll get rid of this towel. You get another one that is just wet. And you'll get rid of your soap all the way down to the bifurcation. Then you'll get another one that's dry. Do the same thing all the way down to the bifurcation. And that'll be your catheter care. Then again, you can flip your resident and do the backside of your resident. If your resident had been circumcised before you did catheter care, you would make sure that you pulled back your foreskin, wipe that area inside there, and then return your foreskin. Okay? And I think that's it. Anything that I forgot? All right, that's it. And then you will make sure that you cover your resident back up for mercy.